Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we'll be talking about what is atypical facial pain and how to differentiate it from trigeminal neuralgia. But before we continue, make sure to hit the subscribe button down below for more and more videos. So what is atypical facial pain? If your face hurts without a clear cause, it could be atypical facial pain. It is an unexplained, chronic, ongoing pain in your face. It might affect your teeth, jaw, cheek, or ear. Previously, it was called persistent idiopathic facial pain. Why is it idiopathic? Because the cause behind it, until now, it's unknown. Now, who gets atypical facial pain? Anyone can get it, but it tends to be more common in women who are in their 40s or 50s. In addition to that, people who have had dental injuries or mouth surgery in the past may be more likely to get the atypical facial pain. How common is atypical facial pain? It is not common. It affects less than 1% of the population. But this number may be higher since the atypical facial pain is often misdiagnosed. Its symptoms may be the same as many other face and mouth conditions, such as trigeminal neuralgia. And at the end of the video, I will tell you the difference, how to differentiate between the atypical facial pain and trigeminal neuralgia. So make sure to watch my video until the end. Now, what causes atypical facial pain? As I said previously, it is idiopathic with unknown cause. It may have a link to psychological issues. Chemicals in your brain called neurotransmitters, they regulate your mood and how you perceive pain. Depression, anxiety, or other mental health disorders, they disrupt the way the neurotransmitters work. They may change the way we feel pain or make us more sensitive to it. We have neurotransmitters in our brain, and they are responsible for regulating our mood. But in case you have continuous depression, anxiety, or stress, the function of the neurotransmitters will be disrupted. They will make us more sensitive to pain. A very slight toothache you will feel that as if you have a burning sensation in your mouth. Now, what are the symptoms of atypical facial pain? People with atypical facial pain have pain in their face every day for at least 3 months. Heat, cold, or touch may trigger the pain. Some people also report that the pain gets worse if they are tired or stressed. Usual psychological issues. The pain may be on the left or right side of your face, often near the jaw or ear. It might feel contained to one small area of your face, or it might spread over your whole face. It actually doesn't follow the path of nerve, so this is how you can differentiate it from trigeminal neuralgia, in that it's not related to the trigeminal nerve, or it does not follow the course of the trigeminal nerve. Now, do people with atypical facial pain tend to have other health problems? Yes. Number one is depression, anxiety, or mood disorders. Number two is irritable bowel syndrome. Why is that? Because those patients, they will keep feeling pain in their stomach, a very severe pain in their stomach. And when they feel such pain, they will have depression because they will compare themselves with other people and saying that why do I have such a problem and other people don't have? And this continuous depression and anxiety will affect the function, the neurotransmitters, and it will lead to atypical facial pain. Lastly is unexplained pain as well in other areas of their body. How is atypical facial pain diagnosed? It is difficult to diagnose. The symptoms are similar to those of many other facial pain syndromes, such as the trigeminal neuralgia. Your healthcare provider will do a physical exam, review your medical history, and evaluate your symptoms. Your healthcare provider may perform tests to rule out other conditions that could make your face hurt. They call this as a differential diagnosis. The test may include, we have dental exams. We will do dental x-rays to check if there's any cavity, infections, impacted molars, or any other dental problems. If this one is ruled out, then we go with the second exam, which is the imaging exams. MRI or CT scan can detect problems in your head, neck, or face. Your healthcare provider may do these tests to rule out the possibility of facial fracture. Maybe you're having a tumor or blood vessel problem. Maybe you're having any one of these. If this one is ruled out, we will do the third test, that is the neurological test. Your healthcare provider uses neurological testing to check the nerves in your face. They may ask you to blink and move your eyes in different directions. They check your ability to smile, frown, and move your lips. They may also touch different areas of your face to check for pain or numbness. Maybe you are having pain in certain part of your face. So all these tests that should be done before you go to the definitive diagnosis of atypical facial pain. Now, how is atypical facial pain treated? We said the main cause behind it is psychological issues. So the dentist cannot treat a patient with such a condition. He needs to send the patient to psychiatric in order to do these treatment modalities. Number one is the cognitive behavioral therapy, which is a psychological treatment that can help people with chronic pain. You learn to identify and avoid triggers of pain. You also learn coping strategies such as deep breathing for managing pain. And number two, if the pain is related to depression, we might recommend to take tricyclic antidepressants. Now we reach to the point. How to differentiate between trigeminal neuralgia and an atypical facial pain. In trigeminal neuralgia, it is a sharp and shooting pain brought on by facial movement, change of temperature, and by touching the face at a specific point, which is the trigger point. Whereas the atypical facial pain, it is dull and its site is ill-defined. So what do I mean by all this? Trigeminal, they will have electric shock-like pain, and the pain will be activated if you touch the trigger areas or the trigger zones or the trigger points. Such as the patient will say that whenever I wash my face, whenever I shave my face, whenever I brush my teeth, I have pain. This is typical of trigeminal. Whereas the atypical facial pain, the pain is dull and its site is ill-defined. They will say that I have pain in my forehead. The second day they will say I have pain in my mandible. The third day they will say that I have pain in my ears. So they don't know where the pain exactly. This is the typical features for the atypical facial pain. So under the trigeminal neuralgia, it will affect the course of the trigeminal nerve. So the three branches, which are the ophthalmic, maxillary, and mandibular, will be affected. So it follows the course of the trigeminal nerve, not like the atypical facial pain where it's ill-defined. It does not follow the course of the trigeminal nerve. It occurs in any area in your face. I am done. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below and comment if you have any questions and subscribe for more videos. Goodbye now.